Good day, global citizens. Welcome to the first episode for 2026 for Dr. Fajembola'S opinion. On this first episode, I have a senior colleague who will be taking us through gender-based violence. And many people, when they come across gender-based violence, they don't know that is a scientific issue. They just take it as is a communal issue, it's political, it's legal. So we are going to look at it from the scientific aspect today, and I hope you enjoy it as much as I enjoyed reading the publication. So please join me to welcome Dr. Adio Funmi. Dr. Adio, how are you doing today?
Very fine, Dr. Azeezat. Thank you so much for having me. It's a pleasure.
Thank you so much for accepting the invite, and thank you so much for showing up. I'm sure our audience will enjoy this episode as much as I did in reading the journal. Let's take our audience through the profile of Dr. Funmi Adio. She's a public health physician and researcher committed to advancing universal health coverage through work in infectious diseases, gender equity, and maternal and child health. Our research has addressed pandemic preparedness, gender-based violence, home-based MCH services, maternal and child health services, quality of antenatal care, and emergency obstetric care pathways in Edo State. She contributes to gender-equitable health advocacy through her professional practice and the EmpowerHer Fellowship Women in Global Health Nigeria, ensuring underserved women benefit from stronger inclusive health systems. Recognized with an award of distinction in public health, she remains dedicated to evidence-driven solutions that strengthen Nigeria's health systems and accelerate progress towards universal health coverage. So before we dive into the discussion, let's see what global citizens are saying about gender-based violence. I just got this some few minutes ago, so it's the most recent. The first is from UNICEF Albania, where they are doing a 16 days activism with UNYA and U Report to discuss online gender-based violence, hate speech, and gender stereotypes. The message was clear: girls' rights are not optional. So this is UNICEF Albania. The next is from Nigeria Health Watch, where they said harmful practices and gender-based violence continue to endanger millions of girls. About 4% of girls are married before 18, and legal age of consent totaling over 24 million child brides. The third highest number globally. Wow. I got married at the age of 24 and I still felt like a child.
Can you imagine? Same year. We got married at the same age.
I can't imagine getting married lesser than before 18. What?
You can just imagine.
What is happening? Then the last tweet is from the Hijabi Mentorship Program, where they said, as we break for the holiday, we are reminded that gender-based violence does not take a break. For millions of girls and women, violence is not a statistic, it is a daily reality that steals safety, disrupts education, damages mental health, and limits economic opportunity. So there are lots of complications of gender-based violence, but people tend to overlook it because anything about women, if women are not talking about it, if women are not researching about it, if women are not raising their voice about it, it's usually swept under the carpet. If it's not taken by a man, if it's not a man issue, it's usually swept under the carpet. So, Dr. Adio, let's dive into the discussion. We keep hearing gender-based violence annually. What is gender-based violence?
Thank you so much, Dr. Azeezat. Gender-based violence is very dear to my heart because even right from when I was growing up, I see women around me being victims of gender-based violence, and our society tend to normalize it, So it was part of the things that made me to dive into public health, because I felt there is a need to address issues concerning gender-based violence. So it was one of the reasons that motivated me to also go ahead to do a research in that aspect. And just to talk about what it is. Basically, it is any harmful act that is directed towards an individual just because of that person's gender, or maybe the social expectations that is attached to that person's gender. So there are certain harmful acts that are directed towards that individual. And it is important for us to note that gender-based violence is a major public health issue. It is also a human rights issue that should not be swept under the carpet, or we should take it with kids' gloves. There are different types. Most of the time, people tend to feel okay when somebody is physically assaulted. That is what gender-based violence is all about. But it's way more than that. There are different forms of it. So we have the physical violence, which is the one that everybody tend to see. It's physical because the individual comes with scars on their bodies, injuries, and all that. Yeah. So we have the physical violence, which has to do with hitting, kicking, slapping. At times, it involves the use of weapon. Some persons pick up belts and use it to whip someone, just because of that person's gender. And then you also have the sexual violence is related to sexual harassment, rape. There are even things like marital rape, which most people don't even know that it is a violation of human rights, where because you are in a marriage, you're in the context of marriage, there is that mentality that marriage gives full access for the partner to have
No
sexual
conflict.
intercourse. Yes, it's not that, oh, as long as you are my spouse, then I have the right to do what I like, even when you don't want it. But anytime a sexual intercourse or anything related to sex is not consensual, it is sexual violence. Then we now have the emotional or psychological violence that has to do with intimidation, manipulation, gaslighting. When one person controls the other person just based on gender. So it is so horrible that it brings down the individual self-worth. The person becomes demoralized and sees herself or himself as not amounting to anything. And basically, it is perpetrated through verbal, just people saying things. Words are very powerful. So whatever you
Yes.
see, it has a way of shaping the person that you say to. That's why at times they will tell you, that's why there's this saying that words are like eggs. Once it breaks and it goes, you can't take it back. So words are very powerful. So they can, that's some form of violence. Then we have the economic violence, which majorly has to do with financial. When you withdraw financial privileges from an individual, it is abuse. And it is important to know that when it comes to gender-based violence, it has to do a lot with power play, power dynamics between two gender, like man and woman. Especially in this our
Yes.
patriarchal system where women are seen as less, they don't have a say, they're not supposed to talk, they're supposed to be quiet. So there's always that power play. It's important to note here, while I'm talking about is that it doesn't affect females alone, but of course statistics point to the fact that females are more affected, but it is both gender. But it has to do with a power play that makes one person to lord it over the other just because of that person's gender. So to just summarize it, that is what gender-based violence means.
Thank you so much for that beautiful introduction, and thank you so much for highlighting that it's a public health issue, a major public health concern. We see in Nigeria where health is about the social, economic, and also psychological well-being of humans, and it takes me
Yes.
to this to the next question on what religion plays as a role in gender-based violence. So, Dr. Adio, what does religion? Because Nigeria is a very godly Nigeria, not just Nigeria. Many countries in the global south, we are
Yes.
very godly people. Um,
Mhm.
what role does religion play in gender-based violence?
Thank you so much for that question. A very valid question, Dr. Azeezat. Like you said, African countries generally, when we talk about religiosity, we are found right in the middle of it. And it is not necessarily a bad thing. But when it is not properly handled, it has its negative aspect, right? So, and from the study that I conducted, we looked at the determinants of gender based violence and we discovered that religion has a role to play. So it can go in two ways. It could be a positive impact or negative impact. Negative in the sense that our really there's this submission that our religion preaches, especially on the part of the woman, that the woman is expected to submit to the man. The woman is expected to be subdued, and just anything that the man says, it's what works, and she doesn't have a voice for herself. So, in this aspect, religion can play a negative role by making it seem, by normalizing the fact that it is okay for the woman to take anything that comes to her. So when the man is beating you, no, marriage is an institution that is created by God, and God hates divorce, God hates separation, and because of that, the woman stays in the marriage despite the emotional abuse, the sexual abuse, the physical
Mhm.
violence. She just stays there because the Bible has instructed that that is where we should stay. And our religious leader, they preach these things on the pulpit. Submission, submission, submission. I've seen several
Definitely.
cases of women affected by this. I'm a Christian, so I've seen a lot in the church that women are affected, that they just stay there. Like, okay, they say I should stay, and then it has huge consequences, so many that we'll dive into later, hopefully. So that is on one flip side. On the other extreme is a positive
Mhm.
aspect, in that our religious leaders, they are people that we look up to. They are credible leaders, as it were. So we look up to them, we listen to them, we respect them. So whatever they say to us, we tend to hold on to them as truth. So in that situation, religious leader can play a vital role when from the pulpit we hear things about partnership, respect for our spouses, dignity. When you preach that, and you emphasize respect, teamwork. It's not just about the man, I'm the head of the home and I'm just in charge.
Exactly.
No, the man should also respect the wife, the dignity of the respect. Sorry, I'm bringing the Bible into it since we are talking about religion, but religion talks about, it
Yes,
says
that's
first
fine.
that
Very free.
man, yes, husband, love your wife. When you love someone, you don't brutalize that person. So
Exactly.
when these things are constantly being ingrained in our minds, coming from the pulpit, it helps to, and it's also an avenue for awareness regarding gender-based violence, that they shouldn't be practiced, the harmful practices, the consequences attached to it, and all that. So it can go either ways for religion when it comes to gender-based violence.
Thank you so much. Thank you so much for elaborating on the role religion plays in gender-based violence. It's usually we usually downplay the role religion plays because of
Yeah,
the
absolutely.
region of the world we come from.
Mm.
One thing gender-based violence is people think oh, it's like marriage institution is sacred. That's how things should go. Are there situations where you've seen when someone was aided out of whether a male or a female, aided out of gender-based violence, like successfully?
Okay, yes, I've seen several cases like that. Some have been directly involved in, others I wasn't involved in, but I heard them sharing their testimonies, about how they were taken out of the violent situation. So let me just give one. When I was doing my NYC, I served in a primary health center in my current state of residence. And there was this woman. I noticed that whenever she came, she was newly young married woman. So whenever she came to
Mm,
the clinic, you see bruises on her. So I was wondering. So there was one day I couldn't, there was no rest in my spirit. So while interacting with her, I think she came for a medical disease, nothing related to the bruises that she had on her. So I now I rapport with my patient very well. I enjoy patient doctor interaction. So I just created a
mm,
very safe environment, very relaxed and chill environment, and I asked her, well, how did you get this bruise? She did, because of the relationship I'd created with her over the course of the
yeah,
time that she has been coming. So she was free to talk to me. So she now explained what she had been passing through. Her husband wasn't with her then, she came with her baby. So she now explained to me what she has been passing through, how her husband has been beating her too. Any small thing, he becomes triggered and he just starts to beat her. I know it takes two to tango, but there is no justification for a man
for that.
raising his hand. There is none. So she just explained that this is what has been happening. No, 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 no. I was angered in my spirit. So I told her, in as much as I don't really want to interfere, but it is my duty as a doctor, you know. So immediately, like we have in my current city of residence, we have NGOs that are in charge of that, women's rights, gender-based violence, and all that. So immediately, I connected her with one of those NGOs, and then they took up her matter. You know, so they were able to offer psychotherapy, you know, counseling session, and then beyond that, they took her, because it's very important. You have to take the woman out of the toxic environment. There are so many
Exactly.
stories I have to share about that women are going through a lot. You know, I see more of women
Exactly.
and less of men. Yeah. So so the angel was able to take out of the toxic situation after offering her psychotherapy. Took out of the toxic situation. They got a temporary accommodation for her and her baby, and then my state offered this a skill acquisition program. So she was registered for that program. It's free. So she was registered. She started learning trade, you know, tailoring and hairdressing. She was learning that, and then of course the NGO reported the matter to the police station. So that was taken care of. I don't know how that side went, but I heard that the police took up the matter and handled it. But the woman was away from that environment, and the man couldn't get to her. So the man didn't know where she was. She was just in another area entirely, trying to build her life and pick the pieces of it. But thank God for this NGO, they offered a lot of support. So she came out of it confident, empowered, and you know, a better person than the timid and demoralized woman I saw in the clinic that day. So, you know, when I see this, it gladdens my heart that out of the many women that are affected, we're able to bring some out of it. But there's still so many people that their stories are unheard, so many cases that are unreported, women that are suffering, that we need to find a way to reach them and reduce the global burden of gender-based violence in our society.
Thank you so much for elaborating and sharing that story with us. There are similar stories across the world to what you've shared with us. And one
Mhm.
thing is, we need to know that we need to create safe spaces. And one of the safe
So,
spaces is the hospital having an excellent doctor-patient relationship so that the patient can speak up on what he or she is going through. And also,
yes.
kudos to NGOs working towards to curb gender-based violence at all levels.
Mhm.
It takes a lot
Yeah.
of work, it takes a lot of commitment, it needs a lot of funding because you
Yeah.
mentioned accommodation. That is a lot of funding anywhere in the world
Mhm.
today.
Yes, absolutely.
Also, it takes me to the next question of when we started at the beginning we talked about a tweet where they said girls below 18 years getting married and facing gender-based violence. Now, gender-based violence is not, it doesn't get better with age. Let me put it that way. There's not like, oh, if you are 50 years, you handle it better, or if you're less than 18 years, you handle it better. What is the age group for gender-based violence?
All right. Thank you so much for that question, Dr. Azizat. Truth is, there is no age restriction from that little girl, that baby, up onto that old woman. Everybody is affected, and not just the men, not just the women. I keep making emphasis to the women because we see more of that, you know. But all sexes and all ages are affected. But the study that I conducted, it was focused mainly on adults, so 18 and above. So my study revealed that the median age was 30. So we see women in their 30s, early 30s, being affected by gender based violence more than other age group. And go figure, because if you look at that age, it's very critical in the life of every woman. That is the age where everybody expects that you must have made something, something out of yourself in terms of marriage, in terms of having a
Yeah,
job and being independent. So
exactly.
it's a period that is filled with a lot of pressure, you know. So at that age, if you're not married, everybody is watching. Why are you not married? And then you are pressured into wanting to stay with a man that has a tendency to abuse you, because you're just open to anything. As long as I have a man, I am okay. And that
I don't
shouldn't
have a home.
exactly. Let me have a home. Let me be called a missus. Let me also have my own children. So when you find yourself in a toxic environment, is it you think about what people will say if you leave that situation. So you just keep persevering and you stay there and the abuse keeps mounting and mounting. And like I also said, when it comes to gender-based violence, we see it in many places, in the home, in the workplace, in public spaces, they're all over the place. So also in workplaces, maybe a woman in her 30s hustling for work, and then your boss is just making advances at you, that this is sexual assault, this is coming to you because you're a woman, and you don't want to leave the job because you're like, if I leave, where am I going to? So
No.
you're pressured. So these are some of them. And then you don't want to be financially incapacitated. So you are pressured to just stay in that toxic environment and just endure the violence that goes on there. So these are some of the factors that could be due to why we are seeing a larger proportion of affected women in this 30s age gap. But like I said, all age groups. In fact, there are so many stories, all age groups. So in recent times, you see little children, small girls being assaulted by their uncles, by their fathers, in the home environment. People that are supposed to be protecting you, people that you should trust. They are the people that
Yeah.
are perpetrating these things. So it's cut across all age groups, to be honest.
Thank you so much for that. On to a larger percentage, I feel this is why we need to encourage kindness and to build kind people for current and future global citizens. And it starts with us because the younger
Absolutely.
generation, they will see what they see in others, what they are going to imitate, that's what they are going to do. And
Yes.
currently, those are exhibiting gender-based violence is what they saw, what they felt was normal. That is what
Yeah.
they are doing, what they saw from their environment. And this
Absolutely.
takes to we not just surrounding ourselves with kind people, because when you have kind people around you, not just they are careful of what they say to you, they are careful of how they treat you because they won't want to treat them that way. They are careful of even withdrawing financial support from you. They are careful of
Absolutely.
laying their hands on you. So it's important to be not just in the home but also your work environment. Make sure you are in a good work environment. I've been in
Absolutely.
different work environments, so I know what I'm saying. Make sure you're in
Mm.
a good environment, in as much
Yes.
as there is job will I how will I put it? There is, it depends on type of job you have anyway. There's some jobs that is replaceable, the jobs are not easily replaceable. But
Mhm.
having a good environment makes you thrive, be it the home, be it
Absolutely.
the workplace, be it the community. So
Yes.
this is an avenue to urge current and future global citizens as you're watching, because anybody watching this, I believe they are above 10 years old, they understand what this is. Be kind people. Be kind people.
Yes.
That's just the essence. Be kind people. Be
Mm.
God fearing people, not just religious people. We're a religious nation. Many countries in the global south, they are religious
Yeah.
nations.
Mhm.
Are they God-fearing citizens? So it's not just about worshiping God. Do you fear God? Because when you fear God, there are things naturally you won't do. There are things you want to do to your niece. There are things you want to do to your neighbor. There are things you won't do to your spouse. There are things you won't do to your worker. So thank you so
Mhm.
much for elaborating on that, Dr. Adio. The next
Thank you.
question: Nigeria is a growing nation, and we are doing a lot of work, and NGOs are coming in, not just the government. And I do say the government cannot do it alone. NGOs are coming in to help the government. The relevant stakeholders are coming in to help curb gender-based violence. As we saw in Albania, UNICEF is doing something. What mechanisms has Nigeria put in place to make sure post GBV violence victims are well taken care of?
Very important question, Dr. Azeezat. Kudos to the Nigerian government. They are doing a lot. They are doing a lot, but gaps still exist. But thank God that there is a mechanism in place, that we can follow both public, private partnership, everything is working together. So I will start from the fact that in Nigeria, we have an act that protects anyone from gender-based violence. So we call it the Violence Against Persons Prohibition Act. I think the last one was in 2015 that was published. So it criminalizes gender-based violence. So if you are violent against any person, based on that person's gender, you are liable. It's a criminal offense that can be prosecuted. So the fact that we have a legal framework already in place that gives us the legal backing to take action when we see individuals affected by gender-based violence. And beyond that, like I mentioned earlier, we have there are many NGOs, the Mirabel NGOs. There are many of them. I cannot even start naming. Their hotlines are everywhere. They are easily accessible. Once you call, they are there to provide that support. Then we also have the health sector. They have their role to do. The Federal Ministry of Health, the Ministry of Women Affairs. We have all those institutions there, so that just in case when this thing happen, you can easily reach out to them. Although when it comes to our health sector, I think there's still a lot to be done. We see the NGOs taking the bulk of this, while the health sector, it's okay. I guess it's because there is limited awareness in that aspect, but for NGOs, they're always out there. They're always you see it on social media, mass media. They're always talking about it, and sharing hotlines that you can reach just in case. For example, when you go to some of these primary healthcare centers, you see their hotlines displayed on the walls, so that just in case anybody is affected, you can put in an anonymous call, and then you can easily be offered help. Then another aspect that I would not fail to mention is our law enforcement agency and also our justice system. Which brings me to a case that somebody shared with me recently, that a woman came to the hospital. She carried her baby. The husband followed her. The husband's face was going very hard. The woman had bruises all over her body. So immediately they went to the consulting room. I think one of the nurses or doctors immediately called the police. And before we knew it, police, before the my friend was sharing with me, before he knew it, police had swapped him. They came in and took the guy. So I don't know what he couldn't give me. Happened in Asaba, so he couldn't give me the full. He didn't know the full gist, but it was obvious that somebody had reported a case of gender-based violence, and the police swapped him to pick the guy up, so that to protect the woman from further harm. So we cannot, underplay the role of our law enforcement system, and of course, such persons will be taken to the court and prosecuted. So it's a collaborative effort, in the sense that we have a framework already existing to protect such persons. And then we have the health sector, we have the law enforcement agency, we have the justice system, we have even our social welfare services, all collaborating together to ensure that if such persons are found, they are helped. But like I said, the gaps still remain, because bulk of these cases are underreported. People don't talk. We don't speak out because of our social norms, our cultural norms, So, but I'm hoping that this is also an avenue to disseminate, to create awareness regarding gender-based violence. So we're hoping that we keep reaching more people, and the burden of these menace will drop, God willing.
Thank you so much for that, Dr. Adio.
Thank
We've discussed extensively, to me, we've discussed extensively on gender-based violence. And I feel our audience, they're already knowledgeable about gender-based violence at this point.
Mhm.
But the next question, let's just go to the next question. And three
Okay.
things you want our audience to know about gender-based violence. Three things.
Okay, so first of all, it is important for us to know that it is not genetic. Yes, you don't inherit it. It's not in your genes, and then it is learned. People learn it,
Okay.
and the one of the commonest ways of learning it is when you see. When they talk about leading by example, you see children that if you watch it very well, if you look at history of perpetrators of gender-based violence, they live in
Yeah,
homes that experience such. So they see their parents, they see what their father do to their
exactly.
their mother, and then they just picked up, they normalize it, because they feel, oh, that's the environment where we grew up. That is also, they watch people
That's
do it, for
norm.
example. Yes. So they feel that it's okay. And then the woman stays in the environment and is not saying anything. Oh, they feel it's normal. So they grow up to be violent adults. So it is not innate, it is learned. Then another thing I want us to know is that the fact that somebody is aware of gender-based violence, and the fact that the person knows that, oh, this is a human rights issue and I can actually report it to the police, it doesn't translate to the fact that the person would how would I put it? It doesn't translate to the fact that the person will reject violence. So I'm talking about in terms of survivors and in terms of perpetrators. They know, but they still go ahead to do these things. Even some women, they know, but they think about a lot of things. Hey, I want to shame my family. How can I leave my home just because my husband is beating me? And they tell you, stay there. Don't go. Build your home. A wise woman builds her home. And then you stayed, I'm telling you, the things there. And they stay there, they keep suffering. So they know the right thing to do, but they don't do it. So when we talk about the delays in seeking care, this is one of it. But you're hesitant. Then at times, some of them, the consequences are fatal for some of them. They die. We know the stories, that fly around. Remember the story of
Exactly.
yes, of Osinachi. So they know the right thing to do, but because of pressure, because of our social and cultural norms, we stay in that toxic environment and we go ahead to endure it, and the consequences are usually not palatable at all. Then another thing that we should know is that there are various there are many factors that play a major role when it comes to gender-based violence. So it's not just one thing. There's so many things that we need to look at. For example, we talked about people that have lived in such toxic environment before growing up to be children, to be adults that will be perpetrating that same violence. We also need to consider gender. Our patriarchal system tends to place more value on the male child than on the female child. So the male child has some sense of dominance and feels that the world, that anything he wants must fall at his feet. There's no respect, there's no dignity. So then we also have our social cultural norms that tend to normalize this behavior. So there are various factors that come to play when it comes to gender-based violence, and we need to watch out for these things. And once we see the signs, we need to speak up. It is not just the duty of the doctor or the federal government or the mass media. Even we, in our smaller sections, our smaller court at the grassroots level, we need to speak up. It is our duty to speak up against gender-based violence. Thank you, Dr. Azeezat.
Thanks so much, Dr. Adio, for that. We often think the I say we the global citizens often think, and especially those in toxic environments, they often think, oh, it's just affecting me, it's not affecting the child. So there is no need. I can take it in. The children are safe, or by the other colleagues are safe since it's targeted to me.
Mhm.
How does gender-based violence affect children?
Oh, it has a long-lasting effect on them. There is immediate effect. There is a medium, midterm, medium,
Intermediate.
intermediate. Thank you. And then there's the lasting impact on them. Which will bring me to this story. There's a friend of mine, the sister, the husband of the sister, beat her to stupor and left her in the pool of her blood. And the children watched everything from beginning to the end. And by the time the girl's parent came in, somebody called them that they're about to kill your daughter. By the time the parent came in, the children were in shock. They were in shock. They had to take the children to the hospital because the children couldn't talk. They were just like it was that bad. So you can imagine such children, your heart will break for them. So it has emotional impact, and this is the scar that we don't even see. It's that emotional impact, psychological impact has a lasting effect than every other because the child is scarred for life, especially if the child does not get quick help in terms of psychotherapy and all that. There's that permanent scar. And then, like I mentioned earlier, such children, they may grow up to become violent adult. Then another thing is also in terms of their academics. You see, so when you teachers need to pay attention to children. When you see a child that is doing well before starts to slack off, watch very well. You need to go back to the home. What is going on? Some of these children, they are from homes where gender-based violence are being perpetrated. So because of what they see, it affects them academically. They can't concentrate in class. They can't pay attention because their minds are not just there, because the home environment is not conducive for them in any way at all. Then it also affects their behavior. You see, some of these children, they bully other children in school. They beat other children. And then you wonder, such sweet child, why are you beating this person? What happened? When you dig deep, you
Exactly.
see that it is rooted in what is happening at home. So, and when these things happen, they have lasting impact. These children, they grow up to be hooligans, to be bullies, to be adults that will do the same thing to other people around them. So it
Yeah.
goes beyond just that childhood period. Unfortunately, the childhood period also is a fundamental period that whatever is ingrained into them, to remove it can be pretty difficult. So it cuts across all areas of their life, their mental health, their academics, their social interaction, as well as their physical health across board. So it's important that when we see such children, we need to take them from that environment immediately and give them the help that they require.
Thank you so much for that. I believe everyone listening now know the effect on children. And as I said at the beginning, trying to reduce this for current and future global citizens. Future global citizens are the younger generation, those watching us, seeing how we eat, how we move, how we do our actions, basically. And the younger generation, they are seeing our actions. That's what they imbibe in, but rather than what we say. We can speak from now till next year, but what they see us do is what they are going to redo. So thank you so much for that, Dr. Adio. We I when I read the publication, I had a different view. But seeing the question now, I'm seeing it in another light. But I feel you understand where I'm going to.
Okay.
5 examples on types of gender-based violence situations.
Okay. Okay. Thank you for that question, Dr. Azeezat. Let me start from the one that is very common in our environment, in Nigeria. It's harmful cultural practices. And you mentioned one earlier when it comes to early marriage for children. You you hear men marrying their grandchildren. You pick a 12-year-old, 11-year-old child. Why? How? What is going on in your mind when you decided that you, as a 60-year-old man, you want to marry a 12-year-old child? A child. So early marriage. Let me go. This issue is very dear to my eyes. I get a bit emotional when I'm talking about it because I've seen so many people that are close to me, neighbors that are affected by this. So early marriage, a child that is not an adult, you marry that child abuse. Another thing is female genital mutilation. It's still very much going on in Nigeria. And you even see some medical practitioners being the one doing the female genital mutilation. It is violation of human rights. It is gender-based violence when you cut a woman's part. Another one is widowhood rights. Our culture is very rich, but some of them are harmful. You see situation where you beat the woman's dead husband and then you the corpse and then you tell the woman to drink the water, or you push the woman in the room with the corpse and tell the woman to sleep with the corpse for 100 days. There are many that you shave her hair against her will. A lot of things are going on, cultural practices that needs to be abolished. Now let's move on to the intimate partner violence, where this one's also very common. You stay you are supposed to be married to somebody that loves you, that cherishes you and adore you and treats you like the queen that you are. But that same person raises his hand on you and beats you. Not only beat you, forcefully have sexual intercourse with you. All in the name of, I'm married to you. I am the owner of your body. So you give it to me when I want. I don't care whether you don't want it or not. I don't care whether you have not fully healed from having a baby. I don't care whether there's anything good, whether you're not in the right mental space to have that sexual intercourse. You give it to me now. That's rape, marital rape. And it is part of gender-based violence. We also have economic abuse, where a man would not allow the wife to work. She's not earning any salary, yet you refuse to give her money. Give her money now. She has needs. She will buy this, she will buy that. She will buy her toiletries and all that. You don't give her that.
Exactly.
You don't allow her to work. You make sure she's at home. You isolate her from friends and family that could offer help. You just want her to be there. Even when she's working and she's earning her money, you are the one that controls how much she spends. You will tell her, even though you are earning 100,000 naira, you only take 20,000 naira per month for the money that you worked for. It is abuse and it is not right. Then let's talk about the verbal abuse. You put the person down on a daily basis. You are worthless. You don't amount to anything. You cannot do this. You cannot do that. Look at what your mates are doing. You threaten the person. If you report, I'm going to kill you, and nobody is going to do anything about it. These are the things that we're talking about. Then we now have the sexual violence, sexual harassment, when you say something sexually to another person that the person doesn't want, as long as it is not consensual, it is sexual violence. So when you have sexual intercourse with somebody against their will, when you say sexually explicit words to that person, or when there's sexual coercion, those are all types examples of sexual violence. Let me then the last one, child abuse, which is also well practiced in Nigeria, where you pick a 10-year-old and you go and give it to a couple, and those couple, you'll be using that girl to be working. The International Labour Organization has a guideline for how many hours a child should work. Depending on the child's age, there's how many hours the child should work. Every child should be going to school. No child should be found in one home, working, slaving away. That child has one of our fundamental human rights is access to basic education. So she should be in school, not at home, working and slaving away, which we do a lot in our environment. Then, like I mentioned earlier, you see family members assaulting a child and then threatening the child that if you say anything, I'm going to kill you. So these are some of the things that endangers the lives of our women and our children and put them at risk.
Thank you so much for those beautiful examples, Dr. Adio.
Thank you.
We talked about at the beginning, repeatedly, we've talked about finances and how abuse is done financially. What impact does GBV, gender-based violence, play on finances? Because at the end, it compounds to the gross domestic product of
Yes,
a country.
absolutely.
So, what effect does gender-based violence have on finances?
Okay. So this cuts across various levels, like at the individual level. For example, an individual that is affected, a survivor, she has been beaten, battered. Of course, she will have to be rushed to the hospital to be cared for. And in those cases, you don't even see the perpetrator. The perpetrator will take off. So the woman is responsible to bear the cost of the medical care that she has to get. She may not even have the money, but she has to cough it out. So she has to keep spending. And then from there, it also places a burden on our health system, because there are other things that we should be focused on, not things that are preventable like gender-based violence. Then another aspect of this is that for that woman or that man that is affected by gender-based violence, if the person is not feeling well, like she has been battered, he has been battered, that means the person cannot go to work. So if the person cannot go to work, that means the person cannot earn any money. You don't have any money to do anything. You are stuck. Your productivity is low. There's a lot of absenteeism because of what you have faced. So, and you know that all that translates to the overall societal, like you mentioned earlier, GDP, our productivity as a whole. Individuals make up what we see at the societal level. So all these, they have a way of affecting finances. Then, like I mentioned earlier, when somebody is a victim of this, you have there are so many levels involved. Our health system burden on it, our justice system, there's a financial burden on it, right? And then our law enforcement agencies, there's also a financial burden placed on them, and also our NGOs placed on them. So it's beyond the individual, but it cuts across different levels, even up onto our larger society as a whole. So the impact on finance is quite enormous.
Thank you so much for that, Dr. Adio, on
You're
and
welcome.
also on reiterating that gender-based violence is a major public health concern, and it also compounds to affect our gross domestic products as a nation. So every nation should know, if you are ignoring, if you are overlooking gender-based violence, you are indirectly impacting your productivity as a nation. So
Absolutely.
it takes me to the next question of three myths about gender-based violence? I know we have lots of myths, and
Yes.
people don't understand what gender-based violence is, and this is an avenue for people to know about gender-based violence, need to understand gender-based violence. So what are three myths, Dr. Adio, you've come across on gender-based violence in our communities?
Excellent question, Dr. Azeezat. So, first one is that there's a myth that it is a family affair. It's a family affair. It's something we can settle within the home. Please, no, it is not. It is a public health issue, like I mentioned earlier, and it is violation of human rights. It is not something that should be swept under the carpet during a family meeting. These survivors have to be given a voice. Their cases as it is not something that you sweep under the carpet. So we should take it away from our mind that it's something that we can settle at the home front. No. And usually it is because of our social norms that tend to encourage that. No, you want to carry our matter. Why? It is something that we can settle at home. Why do you want to take it to the police station? Let's just sort it out here. Please, it should not be sorted out here. Perpetrators, when these issues are not addressed, when they are swept under the carpet, those perpetrators, they will keep doing it. That means we are enabling them. We are giving them an enabling environment to keep doing it. And they will move from doing it to that one person to others. They will become monsters when it comes to perpetrating this dastard act. So that is why it is not a family matter, please. It is a legal matter that should be reported to the appropriate authority and dealt with. Another myth is that, it is the victim that provoked the violence. You see victim of rape, they will tell her, it's because of the way she dressed now. Look at her, she dressed like a slut. Please, there is no excuse. Dr. Azeezat, laughing. It is well. They say no. And why did she dress that way? Please, she has a right to dress any way she wants. It is her body, it is her right. There is nothing that justifies a man raping a woman. Nothing. Or maybe raising, they say no, her mouth too is too sharp. She's always talking.
That's why they beat her.
Yes, that's why they beat her. Let me even share this story with you that happened to
You don't know
somebody
how to
that
talk. That's why they
you
beat
don't know how to talk. You don't have respect. So we'll help you. If something happened recently to someone close to me, and the husband, they were having marital issues, So the husband spoke with his friend, and his friend told him that, look, until you slap her mouth and beat her, in the African context, we tend to see wife beating some, not of course, not everybody, as a way of disciplining the wife. And she's your wife. You are the head over. You can discipline her by beating her. Please, it is not right. It is not right. So the friend told the husband that, look, when you beat her once, she will be calm. And do you know, because of the counsel of that person, he went ahead and beat the wife. It did not end well. It was very bad. One person could have died that day. For what? For what? Something that you could have sat down and then you'd conflict resolution, dialogue, we'll talk about it. But no, you felt it was that way you're violent. That's when you're showing that you're a man. Please, it's not. A man that raises his hand against a man, I'm sorry to say, but the person is a coward. Is a coward, has no respect for that woman. So it's not, please, there is no justification for it. There is nothing the victim could have done that would have warranted violence. Then another very important one, which I also mentioned earlier, is the fact that gender-based violence does not affect only women. In fact, globally, we have about 13% of men affected by this by gender-based violence. So it's not just women. Men are also affected. Yes, it sounds like is it possible? But it is. There are women that beat men, deal with them. We've had stories we've seen. So it is real, and it does not affect women only. Thank you, Dr. Azeezat.
Thank you so much for that on clearing the myths on gender-based violence. Now diving into the paper, deeper into the paper on statistics gotten during the research. 31% of Nigerian women have experienced gender-based violence. What socio-cultural norms have contributed to this? I believe we discussed this earlier, but just some more light on it.
Okay, so I won't dwell much on it since we've talked about it earlier, but just to reiterate what I've said earlier, we operate a patriarchal system in Nigeria. So the men are seen as they are everything. Women are just meant to be in one corner without a voice. So over time, that has normalized gender-based violence. Like I mentioned earlier, our culture might have normalized the fact that it's okay for the wife, for the man to beat the wife as a form of discipline, right? Then the woman, you're not expected to say anything the man wants. You embrace it like that. So if the man wants to have sex with you, even though you don't want it, you have to release yourself. If the man beats you, you stay. We don't accept that you leave your home. What is it that you pack your home, you went, what, we don't use it. You will bring shame to the family. You are going to shame everybody. Who is it in this family that you have seen that pack out of their husband house? You will stay there. So it plays a major role when it comes to our patriarchal system. Is it's not really doing well for us in some aspects, especially when it comes to gender-based violence.
So thank you so much, Dr. Adio, for that. On that question from the paper, diving deeper into the paper, on 40% of men
Yes.
have never heard of the term gender-based violence. I believe, when I read this paper, I believe, even if they've never heard of the term gender-based violence, they know what it is. If you are doing
I agree
something
with
good,
you.
you know you are doing something
Yes.
good. If you are doing something
Yes.
bad, you know you are doing something bad. If you are receiving
Absolutely.
something good, you know you are receiving something good. If you are receiving
Yes.
something bad, you know.
You
You might not
know.
have a term to place
Yes.
on it, but you know what is good and what is bad. So
Absolutely.
how can we improve awareness in Nigeria since 40% of men don't have never heard of gender-based violence?
Imagine a huge proportion in an urban community, not even
That's
in
almost
the rural area.
half.
I agree with you on what you said that yes, they may not know the terminology, but when it comes to what it is, like those bad things, those good things, you know them. So, but I think that we still need to create more awareness regarding this. So, it's important to mass media is something that reaches everybody. As we are driving, people listen to radio, we jam to it and all that. In my environment, we do that often, radio, so that's a good platform to churn out this awareness of the impact of gender-based violence and the fact that it's a criminal offense. And I think that should be like earlier this year, I had an opportunity to do a radio show, and these were some of the things that we talked about, and we had people calling to ask questions. We gave them hotlines so that they can reach out. So it's mass media plays a major role, especially social media. These days, where everybody has an Android phone, we are all looking at Facebook, we are looking
Yeah.
at Instagram. Those are avenues to do social media campaigns to target our men so that they will know. Then another thing that we need to do that, look, it is important that we catch them young. When a child, a boy, learns to respect the woman or the female, as it were, from when it is ingrained in him from childhood, that child will grow up not to be a perpetrator of gender-based violence. So it's important that one, at the home front, the parents teach this to the children, to the male child, and also the parents lead by example in the home front. And then it should be added to our curriculum. We have had opportunities to work with students, with schools, in the course of my public health interventions. And I discovered that gender-based violence is not clearly spelled out in our curriculum. So I think it is important that this should be added and should be taught in the school. So we are teaching it at the family level. We're also teaching it in school. Then lastly, we have community engagement. We cannot we've mentioned it earlier before. We have gatekeepers, like our religious leaders. These are people that we look up to. Our traditional leaders, so there are core people like that we can use as agents of change that would shine light on the impact of gender-based violence and preventive strategies for such. So these are these are things that we can do to help create awareness so that our men, our male children will know about this, and they will also be also carriers of this same news of change, so that at the end of the day, there's going to be a reduction in the global burden.
Okay, thank you so much, Dr. Adio, for that. This is an avenue to let relevant stakeholders working to curb gender-based violence in our communities
Absolutely.
to know that media, we cannot underestimate media, we cannot
Absolutely.
underestimate generational dialogue, we cannot
Mhm.
underestimate good mentorship and
Yes.
other mechanisms we can bring on board to help cope gender-based violence. We're in the 21st century. We should think 21st century. We should do
Absolutely.
21st century. It
Absolutely.
takes me to the next question on you've given a lot of recommendations, which is good. And I feel even those who are in power know what to do. But
Yes.
I feel sometimes we need to get perspective from people from other fields. You're a public health personnel. If you are made the minister for health, minister for women affairs in Nigeria, how will you bring relevant stakeholders on board? Which relevant stakeholders will you bring on board to help curb gender-based violence?
Thank you so much for that question, Dr. Azeezat. I've mentioned some aspect, but like I said, it requires a collaborative, a concerted effort. It's not what one individual or just one group of persons can do. So it's important to bring all key players together. And of course, at the government level, we have policymakers that we need to bring on board. The commissioner for health, the minister of health, they need to be part of it. And then we also have the law enforcement agencies, like I said earlier. If such persons are found perpetrators, they should be prosecuted. So we need to bring these people on board. We need to bring in the justice system on board. We'll collaborate with them. Then, like I mentioned earlier, there are NGOs that are very passionate about gender-based violence. We need to bring them in. So there are some things that we may not be able to do at the government level. When we partner with them, we amplify what we can do together as a team. Then we cannot also rule out the health sector, of course. They are the ones that will provide the medical care, right? The counseling, the first aid, and all that. They should be brought on board. But one thing that I would just say is that yes, we have an act, we have a policy, but we need to consider implementation. It's on paper already. Praise God. But what about the implementation? We have to take it beyond policy to action. And that is where all these key players will come together to collaborate. And sincerely, if we want sustainability, it is a public-private partnership that will really help. So when we have the government or government people in power, we have them there. We have the private sector to also coming in to collaborate, and then we work together as a team to achieve a common goal in addressing gender-based violence.
Thank you so much for that. Where do you see gender-based violence in Nigeria in the next decade? I know we are doing a lot of work now on it where there
Yeah.
is improved awareness. Where do you
Mm-hmm.
see us in the next decade?
So, like I said, policy alone is not enough. We need to translate our policy into action. And we know that the root of it, like I said, there are many factors that play a role, but the root is our social cultural norms. So I think that I'm seeing a beautiful future for us because we already have the legal framework on ground. So we have what we need to fly and do the needful. So I see Nigeria getting to a space where we have increased awareness, using various platforms that I've earlier mentioned. We're increasing awareness about it. Women are getting to know their rights. Men are getting to know their rights. They are getting to stand against gender-based violence. They are learning to speak up for it, and remove themselves from toxic environments like that. So I see us getting to a stage where the voices when it comes to gender-based violence, we are hearing more of it. People are getting more aware of it, and we are reducing the trend of gender-based violence in our environment. It is achievable. We can do it. We have all that it takes. Yeah, but we need to keep talking about it, and harmful sociocultural practices should be properly addressed. When they are addressed, it will reduce the menace of gender-based violence. So I see us going places with it because we already have what it takes. We have a solid foundation for it.
Thank you so much. I also stand with you. I support you on that. There is increased
Thank you.
exposure, there is increased advocacy, there is increased awareness, there is increased
Yes.
education. We're improving
Yes.
on everything. I believe gender-based violence in Nigeria will
Mm.
be reduced drastically in the next decade. And Nigeria has the highest population for now in Africa. whatever is seen in Nigeria is also translated to other countries, sub-Saharan
Exactly.
Africa.
Exactly.
And I believe also other countries around in sub-Saharan Africa would have reduced gender-based violence in the next
Absolutely.
decade,
Absolutely.
with or without disasters, with or without other crises going on across the world, because also crises also increase the chances of gender-based violence across the world. So thank you
Yeah.
so much, Dr. Adio, for sharing your time, for sharing your expertise
Thank
with us. This
you.
is a very interesting paper from the public health perspective, which I enjoyed reading, and I mentioned at the beginning. It's a paper
Yeah.
I enjoyed reading. I believe our audience will enjoy reading it and watching this video. Please don't share this, as Dr. Adio mentioned, a man advising his friend to beat his wife because her mouth is too sharp or something like that. It's not just keeping the knowledge to yourself, it's about sharing it. Some people, they
Yes.
give the advice from what they know, their knowledge, their
Yes.
exposure, what they know. You can only
Absolutely.
do what you
Yes.
know. And
Yes.
like I was at in medical school, the eyes only sees what it knows. So
Yes.
and you can only do what you know. So please,
Mhm.
please, please, please share this with your family, friends, everyone. You know, someone can also be at the continuum of receiving gender-based violence, and they don't know that that's what they're receiving. They don't even know that what they're
Yeah.
experiencing is really bad. You understand? Because they don't
Yes.
know it. So they cannot even change their environment, they cannot change their situation. So please
Mhm.
share it with people. These platforms for people 10 years, above 10 years, from 10 years up, or let them know what is happening. So if your child is experiencing violence and gender based violence, they can tell you, mom, dad, this is what I'm experiencing. If what are they calling, if a child bride is experiencing violence anyway, she can tell,
Yes.
this is what I'm experiencing. So please don't keep this
Yes.
knowledge to yourself, share it with others. This is a platform where research meets understanding and legacy. It's not just watching this video, it's about implementing it, like Dr. Adio mentioned, policy, putting it into action. It's not just about making the policy, talking in the rooms that matter. It's about action. And one of the ways
Yes.
you can do action is sharing with this with colleagues, friends, people you care about. Let them know. And that's how you create awareness and have a better decade, not just in Nigeria, but across the world. So thank you so much once again, Dr. Adio, for sharing your time and expertise with our global citizens. Thank you for spending your time with us. We believe this is as impactful as we hope it would be. Have a blessed week, everyone.
Thank you so much, Dr. Aziz. It was a pleasure.